Most treatments reduce pain, but don't fix the problem. If you've been dealing with heel pain for months, you've probably tried stretching, icing, rest, maybe even cortisone injections. And while some of these might have given you temporary relief, I'm willing to bet the pain came back. That's because most traditional treatments focus on managing symptoms rather than actually healing the damaged tissue. My name is Dr. Andrew Schneider. I'm a podiatrist in Houston, Texas. Today, I'm going to show you the difference between treatments that just mask your pain and treatments that actually heal your heel. More importantly, I'm going to explain how to choose the right treatment based on what's actually causing your problem. Here's what most people don't understand. There's a fundamental difference between symptom relief and true healing. Symptom relief makes you feel better temporarily, but the underlying problem remains. True healing actually repairs the damaged tissue so the problem doesn't come back. Think of it this way. If you have a leaky pipe in your wall, you can put a bucket underneath to catch the water. That manages the symptom, but it doesn't fix the leak. Eventually, you'll need to actually repair the pipe, or you'll be dealing with that bucket forever. The same principle applies to heel pain. You can ice it, rest it, take anti-inflammatory medication to manage the pain, but if you don't address the underlying tissue damage, you'll be managing symptoms for months or even years. Before we dive into treatments that actually work, I want you to know that I've written a comprehensive guide about heel pain treatment that goes far beyond what we can cover here. You can get this guide completely free at www.heelpainbook.com. It contains detailed information about both traditional and advanced treatment options, including ones we'll discuss today. Also, please take a moment to like this video, hit the subscribe button, and share with anyone who's been frustrated by heel pain treatments that only provide temporary relief. Let me start by acknowledging that traditional treatments do have their place. I'm not going to tell you that stretching and icing are useless. They're not. But I want you to understand what they can and cannot do so you have realistic expectations. First-line treatments like stretching, icing, and activity modification are excellent for managing acute inflammation and preventing further injury. If you've just developed heel pain in the last few weeks, these treatments might be all you need. Stretching, particularly calf and plantar fascia stretches, help maintain flexibility and reduces tension on the structures that attach to your heel. This is important because tight muscles and tendons put extra stress on your heel with every step you take. The key with stretching is consistency and proper technique. I'm not talking about a quick 30-second stretch once a day. I'm talking about a dedicated stretching session, holding each stretch for at least 30 seconds and doing this multiple times throughout the day. Icing helps control inflammation and provides temporary pain relief. The best approach is to ice for 15 to 20 minutes at a time, several times a day, especially after activities that aggravate your pain. Activity modification means avoiding or reducing activities that make your pain worse while maintaining activities that don't cause problems. This isn't the same as complete rest. Complete rest can actually make some heel pain conditions worse by allowing tissues to tighten up. Footwear changes can make a significant difference, especially if your current shoes are contributing to the problem. Supportive shoes with good arch support and cushioning can reduce stress on your heel. Avoiding barefoot walking on hard surfaces is particularly important during the healing phase. Now let's talk about supportive treatments that can enhance your recovery. Orthotics, both custom and over-the-counter, work by improving your foot mechanics and reducing stress on the structures that attach to your heel. Think of orthotics like eyeglasses for your feet. They don't cure the underlying problem, but they correct the mechanical issues that contribute to it. Over-the-counter insoles can be helpful for mild cases or as a starting point. Look for insoles that provide arch support and heel cushioning, not just flat cushioning pads. Custom orthotics are more effective for complex cases or when biomechanical issues are a major contributing factor. These are made specifically for your feet and your walking pattern, providing precise correction of mechanical problems. Night splints are designed to keep your foot in a stretched position while you sleep, preventing the tissue from tightening up overnight. This can significantly reduce that brutal morning pain that's characteristic of plantar fasciitis. The challenge with night splints is that many people have trouble sleeping with them. If you can't tolerate wearing them all night, try wearing them for an hour before bed and 15 minutes when you wake up before getting out of bed. Now, here's where traditional treatments often fall short and why so many people get stuck in the cycle of temporary relief followed by recurring pain. Let's talk about cortisone injections. Cortisone is a powerful anti-inflammatory medication that can provide dramatic pain relief, often seen within hours or days. I've seen patients walk out of my office pain-free after months of agony. But here's the problem with cortisone. It's like using a fire extinguisher on a house fire. Yes, you've put out the fire, but you haven't repaired any of the damage the fire caused. The charred beams, the damaged foundation, the weakened structure, none of that gets fixed. Cortisone works by suppressing your body's inflammatory response. While this provides excellent pain relief, inflammation is actually necessary for tissue healing. By shutting down inflammation completely, cortisone can interfere with your body's natural healing processes. Even more concerning, repeated cortisone injections can actually weaken the plantar fascia and increase the risk of rupture. That's why most doctors limit cortisone injections to 2 to 3 per year in the same area. This is what I call the cortisone trap. Your first injection works beautifully. You get 3 to 4 months of relief, but then the pain comes back, often just as severe as before. The second injection might give you 6 to 8 weeks of relief. The third injection may be a month. Each injection becomes less effective and lasts for a shorter period. Why does this happen? Because cortisone doesn't heal the underlying tissue damage. Those microscopic tears in your plantar fascia are still there. The degenerative changes that developed over months or years hasn't been addressed. This brings us to the advanced treatments that actually promote healing rather than just managing symptoms. Let's start with shockwave therapy. Despite its intimidating name, this treatment uses acoustic pressure waves, not electric shocks, to stimulate your body's natural healing processes. Here's how shockwave therapy works. The acoustic waves create controlled microtrauma in the damaged tissue. This might sound counterintuitive. Why would we want to cause more trauma? But controlled microtrauma does something remarkable. It restarts your body's healing response in areas where healing has stalled. When you have chronic heel pain, especially plantar fasciitis that's been going on for months or years, your body's healing process has essentially gotten stuck. The tissue isn't inflamed anymore, it's just damaged and not repairing itself. Shockwave therapy essentially gives your body a wake-up call to start repairing the damaged tissue again. It increases blood flow to the area, promotes the formation of new blood vessels, stimulates collagen production, and activates growth factor and stem cell activity. The treatment itself is surprisingly comfortable. You'll feel a tapping sensation, but most patients describe it as tolerable, maybe a 4 or 5 on a scale of 10. Each session takes about 10 to 15 minutes, and we typically do a series of 3 treatments 1 week apart. The results with shockwave therapy is impressive. Studies show success rates of 70 to 80% for chronic plantar fasciitis, with results that are maintained long term. Many patients note an improvement after just the first treatment, with continued progress over the following weeks and months. Now let's talk about PRP, platelet-rich plasma injections. This treatment harnesses the healing power that's already flowing through your veins. PRP works by concentrating the healing factors in your blood and delivering them directly where they're needed most. We draw a small amount of your blood similar to a routine blood test and use a centrifuge to concentrate the platelets. These platelets are packed with growth factors, specialized proteins that signal your body to send repair cells to the injured areas. Stimulates the formation of new blood vessels, and promotes the growth of new healthy tissue. Here's the key difference between PRP and cortisone. Instead of suppressing your body's response to like cortisone does, PRP enhances and amplifies your body's natural processes. When we inject PRP into your damaged plantar fascia, we're delivering a concentrated dose of the same growth factor your body would naturally produce, but in quantities sufficient to restart and complete the healing process that's stalled. PRP results take longer to appear than cortisone results, usually 4 to 8 weeks to start seeing improvement with continued progress over several months. But because we're actually healing the underlying problem, the results tend to be much more durable. Many patients experience relief that lasts for years, not months. Let me tell you about some of the most advanced regenerative treatments we now have available. These represent cutting edge of heel pain treatment. DPMX is an advanced regenerative therapy that combines multiple healing factors to support damaged tissue repair. It provides growth factors and cytokines and other bioactive compounds that helps to restart the healing process in chronic conditions. The REMI laser is a class 4 therapeutic laser that delivers specific wavelengths of light deep into your tissue to stimulate cellular healing. This process, called photobiomodulation, increases cellular energy production, improves blood flow, and accelerates tissue repair. BPC 157 is a peptide that's shown remarkable healing properties. It can help repair damaged tendons and ligaments by promoting blood vessel formation and reducing inflammation while supporting tissue regeneration. Red light therapy uses specific wavelengths of light to stimulate cellular healing processes. While not as powerful as a class 4 laser, it can be an excellent adjunctive treatment that patients can use at home. These advanced treatments work best when combined with addressing the underlying mechanical factors that contributed to your heel pain in the first place. That's why a comprehensive approach is so important. So how do you choose the right treatment for your specific situation? It depends on several factors. The duration of your pain is crucial. If you've had heel pain for just a few weeks, traditional treatments like stretching, icing, and activity modification might be all you need. But if you've been dealing with this for months or years, you likely need more advanced intervention. The severity of tissue damage matters. If you had mild plantar fasciitis with minimal tissue changes, conservative treatment might work well. But if you have significant tissue degeneration, you'll need treatments that actually promote tissue repair. Your activity goals are important too. If you want to just be able to walk without pain, that's different from wanting to return to running marathons. More demanding goals often require more aggressive treatments. Your timeline matters as well. If you need relief quickly for a specific event, that might influence your treatment choice. But if you're looking for long-term healing, that's a different approach. Let me walk you through how I typically approach treatment selection in my practice. For acute heel pain, meaning it's going on less than 6 to 8 weeks, I usually start with conservative treatments. This includes proper stretching, activity modification, supportive footwear, and possibly orthotics. If there's significant inflammation, we might use anti-inflammatory medication or even a cortisone injection to get the inflammation under control quickly. For chronic heel pain, meaning it's been going on for months or years, I typically recommend more advanced treatments. This is where shockwave therapy and PRP really shine. These treatments address the underlying tissue degeneration that develops in chronic cases. For severe cases or cases that haven't responded to other treatments, we might combine multiple approaches. For example, we might use PRP to deliver healing factors to the damaged tissue, followed by shockwave therapy to activate those healing factors and stimulate tissue repair. The key is matching the treatment to the specific problem. You can't use a one-size-fits-all approach and expect optimal results. I also want to address the role of patient goals and preferences in treatment selection. Some patients want the fastest possible relief, even if it's temporary. Others are willing to wait longer for treatments that provide lasting healing. Some patients prefer to avoid injections if possible. Others are comfortable with injections if they provide better results. Some patients want to try conservative treatments first, even if advanced treatments might be more effective. There's no right or wrong approach. It's about finding the treatment plan that aligns with your goals, preferences, and lifestyle. Let me talk about combination therapy because this is often the most effective approach for complex or chronic cases. For example, we might combine custom orthotics to address biomechanical issues with shockwave therapy to promote tissue healing. Or we might use PRP to deliver healing factors followed by specific exercises to strengthen the repaired tissue. The advantage of combination therapy is that it addresses multiple aspects of the problem simultaneously, instead of just treating the symptoms or addressing the tissue damage. We're creating an optimal environment for healing while correcting the factors that contributed to the problem in the first place. Now, I want to be realistic about expectations. Even with the most advanced treatment, healing takes time. You didn't develop chronic heel pain overnight, and it's not going to heal overnight either. With traditional treatments, you might see some improvements in a few weeks, but lasting results often take months of consistent effort. With advanced treatments like shockwave therapy and PRP, you might start noticing improvement in 4 to 6 weeks, with continued progress over 3 to 6 months. The key is patience and consistency. Whether you're doing stretches at home or receiving advanced treatments in the office, you need to stick with the program long enough for it to work. I also want to address cost considerations because I know it's a factor for many patients. Traditional treatments are usually covered by insurance and have minimal out-of-pocket costs. Advanced treatments like shockwave therapy and PRP are often not covered by insurance and can cost several hundred to several $1,000s. But here's how I encourage patients to think about it. What's the true cost of continuing to live with chronic heel pain? What activities are you missing? How is it affecting your quality of life? What's the cost of multiple doctor's visits, ongoing medication, and time off of work? When you factor in the potential to avoid surgery with all its associated costs and recovery time, advanced treatment often represents significant value, both financially and in terms of your long-term health. The bottom line is this: you have more treatment options than ever before. You don't have to settle for temporary symptom relief if what you really want is lasting healing. The key is getting an accurate diagnosis, understanding what's really causing your heel pain, and choosing treatments that address the underlying problem rather than just masking the symptoms. Traditional treatments have their place, especially for acute conditions or as part of a comprehensive approach. But if you've been dealing with chronic heel that keeps coming back, it's time to consider treatments that actually promote healing. Don't let anyone tell you that you have to live with heel pain. Don't accept that it's a normal part of aging or that surgery is your only option. With the right diagnosis and the right treatment approach, the vast majority of people can get back to their normal activities without surgery. Thanks for watching this module. Please take a moment to like this video if it was helpful, subscribe to the channel for more information about advanced foot and ankle treatments, and share it with anyone who's been struggling with heel pain that just won't go away. Don't forget to get your free copy of my comprehensive heel pain guide at www.heelpainbook.com. It contains detailed information about all the treatment options we discussed today, plus guidance about how to choose the right approach for your specific situation. If you're dealing with chronic heel pain and want to explore advanced treatment options, contact our office to schedule a comprehensive evaluation. We'll assess your specific condition and discuss which treatments are the most likely to provide lasting relief. The link is in the description below. Remember, the right treatment depends on the right diagnosis. Once you understand what's really causing your heel pain, you can pursue treatment that actually heals the problem rather than just manages the symptoms. Thanks so much for watching, and have a great day.